Hello, so I'm just going to go over my patient's medical scenario. So this was a 56-year-old patient, male, who was undergoing a cardiac catheterization due to inability for the left ventricle to pump uh, his left side of his heart. We did, prior to surgery, do a echocardiograph just to detect any heart abnormalities. Then we also discovered from that the patient was undergoing mild endocarditis. And then so before surgery, the patient was pretty much just given the whole concept of what the surgery was to go through and how he would have to deal with post-surgery as well. During surgery, he was told to place both of his arms by his side before he went under any medicines to induce him for the surgery. The cardiologist was the one who made the slight incision in his radial artery just to continue with the surgery. With that being said, the cardiologist did determine that it was a success. He was able to do an angioplasty and put a stent in the left anterior descending artery of the patient's heart. But then 3 hours after post-surgery, the patient was experiencing a few heart abnormalities. During the patient's orientation prior with the cardiologist, he did tell the cardiologist that he had a history of heart murmurs, especially in his youth. And after the surgery, the patient seemed to undergo atrial fibrillation as well as ischemia. And then after that, he was rushed to the ER. With that being said, after that, he was hospitalized for 3 days with multiple EKG tests being done, as well as sphygmomanometer readings just to calculate blood pressure and heart rate rhythms and all. The patient did seem to have everything a little bit more stable. He did experience visible signs of bradycardia, as well as having a blood pressure usually between 98 over 58 and 110 over 62 millimeters of mercury. The patient now is undergoing physical therapy as well as cardiac rehabilitation just to facilitate his recovery process and to regain his overall strength.